Hi, dear Final MBBS students and medical students. I welcome Dr. Bhuvneshwaran, Professor of Psychiatry from Tirunelveli Medical College. He is a mentor for students and a best motivator, and he is a mentor for PG aspirants. He is the franchisee for Tirunelveli concept, and I am happy to welcome Dr. Bhuvneshwaran. He is a very dedicated, in a single word I can say, dedicated psychiatrist. He is one among the gift for the entire medical as well as the entire society. Welcome, my dear friend. Yeah,
Welcome.
please introduce about yourself, Nanbal, a little bit more. If anything I missed.
Okay. I am interested more in guiding and mentoring students, and I am also interested in counseling and psychotherapy. Area of concentration is relationship counseling and students counseling.
Yeah, that's a very important one. The student counseling is, I can say, I can feel, I can tell that is a very important aspect for entire society, because whether the medical student or a non-medical student, the students who needs appropriate counseling and guide them in an appropriate way, they can catch their growth and they will save the time. That will save the time a lot. Okay, we will go to the subject proper. Today, what we are going to discuss is next or exit exam is going to be in 2026. This is a one which is very hot news now. And what is our point of discussion? How, as from the concept team, what kind of guidance we are going to give for the final MBBS and other medical students is the important aspects now. Yes, my friend, what do you think about? Because you are one among the person in continuous medical education among in government service. What is your view? Like next exam, which was very feared exam, and all medical students are feared for 2023 next, which was proposed previously. Now it has been like a discussion is going on next in 2026. How do you seriously view this? Because as a pre-final year student and final MBBS students who are very much bothered about this, what kind of guidance you can give about this, my dear friend?
So, as on date, the good news for the current students is the current second year or pre-final or final year MBBS students need not worry about next exam. They will have the NEET PG as usual. Because NMC is framing the guidelines for the next, and they are planning to implement it for the batch which is entering MBBS in 2022. That is this 14th February of 2022, one batch is entering. It is actually 2021 batch, but the course is commencing on February 2022. For that batch only, as Anton said, next is supposed to be held on May 2026. So that is one of the good news.
Yeah.
Am I audible, Anton?
Yes, you are audible. Please proceed, Bhunesh. You are well audible.
Okay. So that is one of the very good news. And another good news for those who are joining MBBS this year, that is the future next aspirants, is that it is almost the next exam is made equivalent to USMLE. And there had been a lot of discussions with the World Medical Association and the Federation of World Medical Education to consider this next as a equivalent to USMLE. So previously,
we will discuss about this, Bhunesh, in the subsequent question.
Okay.
So one good news for MBBS, final MBBS and pre-final year students are like next exam is on May 2026. Number one. So for the upcoming batch whoever has joined medicine, only they are going to face the next. So then in this is, I can really appreciate the government of India, which is working through National Medical Council. Instead of putting a sudden changes in a very 6 months notice, 3 months notice, which is really stressful for any medical students, now they have given a adequate time. That is a very important thing. And for the upcoming batch or the batch whoever is running, whoever has joined are going to take the next. Am I right, Dr. Bhunesh?
Yes, certainly.
Yeah,
This is as per the latest news from the NMC.
Yeah, whoever has joined recently are going to take the next. So that is one of the good news. When I join something, I should know what is my profession, how I am going to do in that profession. That is a very important thing, rather than going into the profession and finding it is very difficult. Is not a easy job. That is really, we have to salute the NMC for the wonderful move. That's the way I
Definitely.
really feel. That's the way I really feel. And but one thing which I really want is, like, there are next 1, 2, 3 that is being proposed for these are the videos mainly dedicated for the parents, um, of the kids who have joined the medicine. So kindly enlighten, when is next one, when is next two, one is next three?
So first, we have to know what is next step one. It is not actually next one. Next step one, step two. Step two, there are two parts, and next step three. So
Okay.
next step one is for at the end of the second MBBS. That is at the end of the 24 months of the second year. First year 12 months, there will be university examination. Second year, next 12 months, there will be university examination. And after that, along with that, there will be next step one. So it is just like a pass or fail examination. You have to get 50% in next step one to be eligible for next step two, which is going to happen at the end of the final year. So there is no tension or stress among the second MBBS students to compulsorily pass the next step one on the first attempt itself. They can have a adequate number of time, but at the same time, it is only 50% is needed to pass that. That score will not be taken into account for your PG ranking.
Yes.
So what NMC wants to say is you should be have a strong basics. That's all. You need not be a master of the basics. You should have a strong basics. That is just 50% is enough. So a person who is having a 50% knowledge in the basics is enough to appear for the next step two. So, so the previously when we were writing the entrance, we used to mug up a lot of recall points or very basic points, which will be asked in the APG examination or in the state PG examinations, which will be held 1 year or after internship. So we used to forget a lot of things. So we have to again sit and read and memorize many things. But the
Yeah,
stress
true.
is
Yeah.
truly relieved for the students. So they just finish the first and second year, the 6 subjects, they have a very good memory recall for those 6 subjects. And those subjects, from those subjects, they will be given an objective test,
one
which is
one
very
point
easy to.
one point I want to add here for beloved first year and second year MBBS students. See, even though we say what we face is a tough path, what the path we cleared is not the easy path. But at the same time, for you as a budding people who join medicine likingly, or sometimes parents might like you people to join the medicine. Unlikingly, you may join the medicine. So after that, suddenly some competitive, again one competitive exam. But here the competitive is like pass or fail. So no need to worry. But the thing is, any exam that too is a all India level exam, there will be little bit of stress. How to face the stress is an art. As Dr. Bhunesh said, you can take lightly. That is a way which we want to convey here, because just now we completed NEET, man, we got joined the UG, again another exam, what is this fellows are doing? This kind of thought process should not come. The way the water is running, we should move with that water. That will help rather than stagnating. Yes, please proceed, Dr. Bhunesh.
Okay. So regarding step one, the final point is next step one is not a competitive exam. So there is no stress like a NEET UG or a NEET PG. It is not a competitive exam. This is a pass or fail exam. And you ask any PG aspirant who is appearing for the exam, NEET PG at the end of the internship, they will find what is difficult is the basic sciences, anatomy or biochemistry or microbiology or pharmacology. They find it very difficult to recall or remember and study. Most will be very thorough with the clinical subjects. So that part, that stress is eliminated by this next step one. So the student should be happy that a major chunk of the subjects, for example, writing 23 subjects, studying 23 subjects and preparing at the end of 1 year is very tougher than doing some subjects, 6 subjects before itself and clearing it off, and then going for another 12 subjects. That's very easy. So this is next step one.
True,
So,
Bhunesh. Here, one
okay.
one point I want to ask here. See, this is for Indian students who are writing next in preparing in India. They can take next step one. What about the foreign students, like foreign medical graduates and foreign medical students? In what is how they are going to give next step one? Because almost
Okay.
20 to 30% of the all India medical students are foreign medical graduates. That's what statistics says. So how if the people are preparing doing medicine at Philippines or China, how they have to give next step one?
Yeah. So that is like, for example, like USMLE or like this licensing exam. Even FMG has to clear the step one and step two and step three. So NMC is planning to conduct this next step one in multiple centers, even overseas or in any other country where that degree is recognized by the India, that college or that university is recognized by our NMC. They will conduct overseas. So, for example, in PLAB, we can write even in India, they have centers like that. So, it is an online based exam. So, you can give the exam as soon as you finish your second year. So, mostly the FMG schedule is also parallel to our schedule. So, even if it is delayed, they will be conducting every year. So, you can clear. It is not necessary that you have to clear the next step one exactly at the end of the second year. So, you can clear 6 months later or even during the pre final, you can clear. So, that's not a big issue. So, FMG has to clear, but and also they say that only 50% of the questions will be somewhat a standard. The remaining 50% will be very, very basic. So anybody who passes the university examination can easily clear the next step one. So that is step one. Step
That's
two is
like,
nothing but a
but we can never say that it's like a very easy or very tough.
oh.
So
So
the
the purpose what
preparation.
I said is the purpose what I say is for relaxing the stress of the students. But
Yeah.
whatever it is, you know that those who study well or prepare anticipatingly well, even the first and second year will have a better score, and that knowledge will be helpful to clear the next two also. So
Yeah.
just by passing we
One.
can
Yes.
clear,
Yes.
but
Yes.
that is not important. The knowledge is very important. So
Exactly. Exactly.
while you joining, so that's why the NMC has given the day schedule so long. So while joining your first MBBS itself, you know that I am going to appear this exam after 2 years. I am going to appear. So you will be automatically preparing. You cannot tell that suddenly the government introduces exam, suddenly the syllabus is changed like that. So there should be some amount of orientation preparation, but without stress. That's what we want to emphasize. Okay.
True, true, Dr.
Then
Bonish. One point which I want to ask here again. See, as in in a next step one, how what kind of questions? Because as you said, like
yeah,
we face like a recall type of question, one
don't
liner.
memory.
Now the trends are changing. Even the first year and second year student, even though basics, but the questions are like more of clinical scenario based. How a second year student can face a clinical scenario based? How, because
Yeah, yeah,
even though we coach the students for a clinical scenario based preparation, but as a student, this is exam should be faced by a student even who doesn't take any coaching. For them, what kind of guidance, how it may be, how if suppose a clinical scenario based questioning, how as a student point of view they have to prepare for it.
yeah, definitely. So they have said that the recall or the rote memory part of questions will be limited to 10% or maximum 20%. So remaining 80% of the questions will be clinical scenario based or application based, using a simulated case or a situation or a lab value interpretation, applying analytical skills only they are going to ask it. So from the first year itself, while reading theory itself, they have to think in terms of how to apply this theoretic knowledge in a practical scenario. So of course, there will be a lot of coaching and other mentoring from various sectors. And as far as we are concerned, we will be also as a medical faculty, as a teacher, I will be also motivating the students to learn case based and will be giving case scenarios. But one thing is the student should have an orientation. Okay, this case scenario will be useful for me in exam as well as in the practice, clinical
Practice.
practice also. So they have to have some orientation. They need not just they cannot just like that muck up and write this exam. That is the so they need some amount of minimal coaching from the teachers. So we
Yeah.
will be providing the teaching, but apart from that, they should develop an interest to work out the cases, discuss with the seniors, discuss with the friends, discuss with the experts, to gain the knowledge. Because that knowledge cannot be gained just by sitting for 1 month preparation. So they need a
Yeah.
continuous preparation. They need a continuous interest and orientation towards solving clinical problems. So there is a lot of learning, like problem-based learning, case-based learning, lot of newer medical education teaching methodologies are there. So the undergraduate college should apply these methodologies. The teachers should be, the main thing is the teachers, the medical teachers who are first year and second year, they should have a different mindset. So they should anticipate that this change is going to happen. So they should not think that only the university exam questions, if they write and pass, it's okay. So they should incorporate this aspect of teaching in their day-to-day teaching. If suppose if some institute is not able to do or not able to, we will be there to help. So through various online platforms or through various apps and other things. As Anton, you know very well. So we can offer some help to the students using
One
your
point I want to
expertise.
add here, one point I want to add here, as you are telling, like government is copying the USMLE kind of coaching, which is you are telling in the initial part. As here, I want to add a point to the discussion. Like when the clinical scenario based questions are being asked, most of the time we forget is a lab value. We don't remember what is the exact value for liver function test exactly. So in those cases, in a USMLE, there will be icon which gives a lab value 1, 2, 3. So the pattern of the exam is like as if you to develop a medical student into a consultant. So as a consultant, when we see the reports, we have a normal values, a reference range on the right side of the report. So as this questioning will be coming in a clinical scenario based, as a student point of view, we no need to worry. And solving lot of questions, even first MBBS students level, it will be useful rather than like waiting for the second year or waiting for a big video discussion. You have to discuss as a first and second MBBS student. Group discussion, teamwork makes a wonderful practice which student has to develop rather than highly projected applications. Yes, coming to the point for the step 2, next step 2, Dr. Bhunesh, please enlighten about how next step 2 works.
So next step 2 is nothing but it's a final year theory examination, which will be conducted by the agency appointed by NMC, either it may be NBE or some other different agency, which is the appropriate authority, which is appointed by the NBE. It will be of the same objective pattern. So it will be conducted in May 2026 throughout India. It will be a MCQ based examination, and also here also they give 80% importance to this application and clinical scenario oriented questions. So the thing is, even during all the clinical postings, so previously in our batches and all, we used to miss some postings, we used to scoot some postings or something. But now what NMC is trying to say is, you have to attend all the clinical postings, see the cases, and then get the knowledge about the cases, discuss discuss the case with the seniors or team members or friends or the faculty, and then you have to work up the cases. So this should be done periodically. So it is nothing but a formative. So when you do this formative preparation only, you can easily answer those questions in the exam. So despite of coaching, this coaching or this preparation should start even in the pre-finals, this next step 2, because suddenly if you are reading some theory about a clinical problem, the problem may not be asked directly. So a clinical expert or some person would have guided and interpreted the problem in a right way and would have given a solution. But all the answers could be similar. Any answer can be correct. But what is that? The most appropriate answer should be marked according to the situation, according to the clinical situation. So clinical judgment is very important. So though we may not be very correct as an undergraduate student, we may not be absolutely correct to make a clinical decision, but we should at least near it. And also the standard will be of the undergraduate. So previously in AIMS and other institute exams and all, they will ask something which is of a super specialty or a PG standard, some rare diseases and all. So these things will be limited to less than 5 to 10%. So you need not worry about the rare diseases, rare syndromes, genetic markers and other things. You will see a lot of common scenarios like tuberculosis or hernia surgeries, but in that the twist will be in that clinical presentation. So you have to attend case discussions more, but it is very easy. Actually, the main thing is next step 2 is, previously the PG preparation was very tough and very irritating and very boring. But now the PG preparation or this step 2 preparation will be interesting. So you will be you will be preparing and doing what you are going to practice. So you won't get any bored feeling or something like that. So everything will be like a case history or a story based or a problem based or a scenario based or an application based. So which is a common day to day affair for any clinician or any practitioner. So that experience is given even to the second or third MBBS students or final MBBS students through the next step to preparation. So you will be finding the course also interesting. So you won't cut the classes, you won't cut the discussions. You will start preparing your own case scenarios, will be circulating to your students, and there will be a lot of much more enlightening things and enchanting things which are going to come. So this is about next step two. This is a theoretical examination. So this examination score alone will be taken for your PG ranking purposes. So the pre-final subjects, the ENT, Opthal, SPM, and the finalized subjects, medicine, surgery, OG, pediatrics, and allied subjects like psychiatry, dermatology, anesthesiology, radiology. It will be orthopedics will be the main subjects for this step two. So the mostly the clinical subjects will be there. So the preparation should be prepared accordingly. Okay. Then the this is the part one of this next step two. The part two is the final clinical practical examination. So that is the usual
point. I will come to the point, Dr. Bonish. See, one thing which I want to add here also here is, please remember, my dear students, in step two, where we usually lag is psychiatry. The questioning, the government is exactly copying the USMLE type of patterning, the pattern of questioning. See, here in USMLE as a topper, they give a more importance to behavioral science. In a step one, they call it as a behavioral science. Even in the step one, the behavioral science comes. So 10 to 20, 30 pages will be there, the content in the Kaplan material. That used to ask in the exam. The same thing in a final year, there is step two, that is objective theory, in which the psychiatry plays an important role. And in addition to the psychiatry, the biostatistics, because more of research-oriented questions used to come, and biostatistics, they give a very much importance, where generally as a student point of view, they are find less interest. Nobody wants to know what is nominal, ordinal ratio, all these things that we don't find interest also to read. But that questioning, that area questioning will be very strong. Okay, so keep it in your mind. Whatever given the insight we give is for your preparation over the period of time. We should not exclude, okay machi, nobody will ask this content, there nobody will ask the biostats, nobody will ask epidemiology, nobody will ask, but they will ask biostatistics, research oriented question. Research means that is biostatistics, where the content of the research is there. Epidemiology, the studies like a case control, cohort studies, they used to give a big importance. And more important, I can say, psychiatry, that is a behavioral science, personality disorder, defense, all those areas generally students doesn't touch. There very strong amount of questions comes. Orthopediatrics, everybody answers, okay, but psychiatry and biostatistics are one of the high yield area in step two theory. To add a point of your discussion, Dr. Bonish, because this is how the USMLE questioning used to come. When I was preparing in 2004, 2000, I was giving the exam in 2005. This kind of questioning and this kind of multiple choice question, clinical scenario based question used to come, and we used to face, and we used to prepare a lot, and we used to make a mistake also more in biostatistics and psychiatry, because we do not know which difference it fits. Other questioning we used to answer nicely, but psychiatry question or biostatistics, will be very difficult to answer. Please go ahead with the mood. Yeah, please, Bonish.
Yeah. As you said, in the past 15 years, the behavioral science is getting more and more. Behavioral science and research field is getting more and more attention and importance. And any doctor should know some amount of psychology and psychiatry to do a normal practice to the patients, because the patients are more aware of this communication and everything. And also, previously the psychiatry posting was only about 2 weeks, which most of the students doesn't attend with this sincerely. But nowadays the posting is increased to 4 weeks, and this is SPM is coming throughout your course curriculum. So we have to utilize that, and we have to keep in mind this is going to play an important role in your PG ranking. This is step 2. Okay. So then regarding the step 2 part B, it is a clinical examination, just a final year examination. It will be conducted by the university, the concerned university, at the concerned colleges. So they will be given clinical cases for interviewing, examination, and the presentation of the cases. So this is a routine final year practical examination. This is a pass or fail examination. So you have to pass this also, so that you will be considered cleared next step 2. So without passing this final MBBS clinical examination, your next step 2 score is dormant. It won't be get activated. So only after passing this is activated. So this is step 2 is finished. So you have finished step 2 and you have entered internship. So previously internship was only just you are learning a lot of skills, but there is no certification, there is no assessments. Just 15 days you have finished this posting. 60 days you have finished medicine. That was the completion. It was just a completion. But now what is added to it is a assessment, clinical skill assessment. It is something similar to step 3 of USMLE that Anton will elaborate more. But this at the end of each and every posting. So what the government or NMC wants to say is, usually students start preparing during internship. They skip the postings. They avoid important postings, and they fail to learn the basic and important clinical skills like resuscitation, giving an IV injection, putting a venflan, putting a cut down, a lot of suturing, lot of clinical skills and clinical scenarios, clinical experience they are missing just because they want to prepare for the NEET or some PG exams, and they are missing the basic skills required for a medical graduate or a doctor. So this should not happen. So this tension part of this exam and scoring should finish within the final year itself. So that the students will be stress-free to learn all these clinical experiences, which will be helpful throughout his career. Even if he enters whatever is desired field of choice, he should know the basic clinical skills. That skills will be assessed. For example, in general medicine, they will be assessing how a skill to put a venflan, the skill to do a Riles tube inside a Riles tube, a Foley's catheter, do an abdominal examination, everything, procedures and examinations, and interpret X-ray, interpret an ECG. Basic interpretation, not like a cardiologist or a physician you need to interpret. Just a basic interpretation or basic things. So the concerned assistant professor and the chief or the HOD will assess at the end of your posting, or during the even every week they will assess this. No, okay, this skill he has passed 5 tubes. This skill is certified. They'll certify the skill. So this certification is happening throughout your internship. So you cannot just like that. This posting is waste. This is just you go and give some injections and go off. So this cannot be the scenario. Am I audible, Anton?
Yeah, you are audible. Please proceed.
Please. So this cannot happen because at the end of this internship, the next step 3, what it says is the clinical skill assessment score they have to give. Okay, so each and every department, medicine, surgery, OG, period, even psychiatry, they ask you to do a psychiatric interview. They give a basic. They ask you to assess the communication skills, basic counseling, treat a patient with de-addiction, assess a patient who is having a acute agitation, who is having a severe depression, who is having suicidal ideas. So these skills we have to perform with the patient, and we have to certify. Okay, this person can handle this set of cases. So he is competent. You are certifying these skills. So once all the skills are certified, and you will be given a final score, which is just a pass or fail score. So if it is you are certified as a clinical skill assessment certified, this is next step 3. It will be clear. So and also after that there will be, I think, the NMC is yet to formulate the exam type of thing for this next step 3. So they say that you will be given some still more complicated clinical problems or clinical scenarios, which will be something like an OSCE type or something, which will be also a centralized exam. There will be also pass or fail, but they are it is not it fully finalized by the NMC. But there will be step 3, which is a pass or fail thing. So the certification and assessment should be done, and it should be given by the institute, whether they are approving the same certification or whether they add some more some exam like thing to it. Yes. But usually it is something it is. So that mark will not be taken into your PG ranking. So don't worry about that. Just you have to perform the skill, get it certificate. So that tension is not there. So this is up to the next step 3. So after you clear the next step 3, you will be having certificate of next step 1, step 2, step 3. So step 2 marks will be taken for a PG entrance. So you have to apply for the PG counseling, and based upon the ranking, you will be allotted a different PG seat. So this is up to up to the current date information given from the NMC UG Medical Education Board. This was the information. So The PG
I will,
preparation
yes.
burden is reduced.
Yes,
That is
Dr. Bhunesh, I summarize the point of discussion here. The medical students are going to take step one, next step one, next step two, next step three. Next step one is equal to USMLE step one, which can be taken in the USMLE, also can be taken in the second MBBS itself. And next step two is should be taken at the end of the final year. So in USMLE, it is called USMLE step 2, CK and CS. There are two parts. CK is a clinical knowledge, which is basically a objective type of question, and CS is a clinical skills, which is dummy patients will be given to interpret. That kind of thing is coming as a next step to like objective type, and the next step to skill. That is a step two part, step two part A, part B, whatever the name they create. And the step three, which happens at the next step three, which happens at the end of the House Surgeoncy, is like USMLE step three. In USMLE step three is also the objective type of questioning, almost for a the treatment in the given, because in a US there are certain protocol which changes between the states also, in fact. So USMLE step 3 will be taken in a particular state where a person is going to practice. For example, contraception management varies between the state in US, and medical termination of the pregnancy varies between the. There are certain things which the knowledge which I am having in 2004, whatever the protocol between the states, it's vary. So step 3 in the given state, they used to write the step 3. So this how the government is following or taking the inputs from the US exam. One thing which I can say is we are our system of medical education is improving. Yes, well and good. But I have certain things which I want to end. How, as a medical student, how the quality of life after a medicine, is it good for a doctor? Is I will address this at the end of the discussion. Yeah, before that, yeah, Dr. Bonesh, you want to add a content like next step 2 theory is will be taken for a PG exam. You told in the point of discussion, PG ranking. How long they will consider the score? Because in a gate for a for a engineering students, gate score was considered for valid for 2 years. How they are going to acknowledge? Because here, if you give 2 years, at the end of the 1 year only, they House Surgeons only they can take a PG. So 1 year there is gone. Addition 2 years, if they give totally 3 years, will it be like something like that? Or in USMLE there will be 7 years validity? Please enlighten your vision in that.
Okay. So actually, the purpose that while MC or this NMC introduced this next is, number one is to reduce the stress of the MBBS graduates for PG preparation. And number two is to concentrate them more on the as a practitioner, to develop them as an Indian medical graduate who has to practice at the end of the MBBS. And number three is they have to learn the clinical skills and application skills required for a MBBS doctor. So what the government got inputs from various agencies and various departments is that most of the MBBS graduates, after passing the final year, they are doing their internship just for a routine thing. And they are sitting after internship, they are sitting for 1 year or 2 year or 3 year continuously, and reading a lot of materials in preparation, doing a theory work, and then getting a PG seat. So the aim of any graduate is to get a PG seat. So due to that, what is lost is the 5.5 years education is lost. So it is just done for namesake. So only they introduce this next. So they thought that by making this PG entrance as a final year theory and finishing it off, will make the students just free, and they can learn beautifully during the House Surgeoncy. They can develop the interest in the desired field, desired thing, like that they thought. But there will be loophole in every good activity or good thought. So the loophole here is that once your score in next step 2, if it is somewhat low, or it is somewhat not giving the desired seat or something, which we didn't know, because at the same time the government is trying to increase the number of PG seats, almost 60 to 70% of the UG seats it is planning, and introducing a lot of DNB seats, and making it to a common pool. All the DNB and MD, MS seats are nowadays, now in this counseling, are entered in the common pool. So they are trying to increase the seats and reduce the ratio gap between the UG and the PG seats. Despite of that, the choice of the seats differ. So if a score is less, or what is the solution for that? So there is still a question mark. So as on date, the government is planning to make this score valid for the next 3 years. So first, if I write the next step two, that score is valid for the next 3 years. This is yet to be finalized decision. What we have told before is almost finalized, but this decision is not finalized. But it will be like that only. So next the 3 years it will be valid. But whether you can give the another step two in the after the house agency, it is still a question mark. So it will be discussed elaborately after NMC next decision by asking the students everything, and also whether you can improve the score. But they say that you will be given unlimited number of attempts in next step two. So there is definitely a chance to improve your scores. So students will not worry that if I lost that first next step two in the first attempt, I won't be able to improve. You can improve the scores, but whether you have to wait for 3 years or wait for 1 year or 2 year, because I think they won't allow at the end of internship, because that is the purpose why next is introduced. So because if you allow in the internship, what you will do is you won't go to the internship properly, or you won't concentrate, and you will start reading that. I think they will be giving a 1 year break or something.
Yeah, true. One
So
thing, all those concepts are very good, which I can say. Yeah, you want to conclude with the content. Really, should be a eye-opening for medical students or medical aspirants. Before that, I want to please enlighten like how the USMLE you are telling, like USMLE kind of thing, and a person who completes next one and two can government is thinking like they can go to US also for foreign education, higher education. Kindly enlighten about that, doctor.
yeah, I think the discussion is on with various departments and foreign ministry and everything, but it is in the just in the stage of it's a pipeline only. So of course we can expect that at least step one and step two will be accepted, and the up to clinical knowledge they can accept. Clinical skills are this step three, they have to give at the concerned state. But if the standard of this next exam is on par with the world standards, definitely any country will accept it. So only one thing is we have to accept. So that if we are not accepting, or we are resisting, or we are changing this pattern, and then it may not be accepted throughout the world. So the thing is, this modern system of medicine is same throughout the world. That is what the WHO is also telling, that there will be standardized education, standardized care for the patient. So one country should not get the highest care, and one country should not get the lowest. Every care, the minimum standard should be there. So I think the step one, as far as step one, step two, it will be standardized, and the government can make it equivalent. And after 1 or 2 years, the USMLE or the PLAB may consider it's okay. If you pass this next step two, clinical knowledge, you can directly apply for the clinical skills, and you can, if you clear step three, you can start your residency or something. So I think
Yeah, true. Got
it is
it. Got
halfway.
it.
It
Got
is
it.
halfway.
Absolutely got it.
Halfway.
Yeah. Yes. Absolutely got it. So here, the good news for the student is like next step one, step two are almost equivalent to the USMLE step one, step two, and USMLE is one of the toughest exam. But when we understand the concepts, USMLE is the easiest exam, and the questioning in the USMLE exam will not be uniform for everyone. If a person attends the exam today at India, another person is attending the exam at abroad, or in the same India, in the same center, they will be getting the different question. So all those scores will be determined by the percentile rather than the percentage, and every year they will be increasing the toughness of the exam, because what the exam today will not be same, questioning will not be same for the upcoming batch. So they will increase the standard of questioning. So that's how the USMLE questioning will be there, and it is also there still now. It is also being continued like that. So students all should understand this will not be the same kind of question. Students have to understand the concepts. So when even in a NEET super specialty this year, the questioning is different between the individuals. So even in a NEET PG 4 years back, the questions was different between the individuals. So they will have the question bank. From that question bank, randomly the question will be coming to each and every individual. And I think we have elaborately discussed about this, Dr. Bonesh. And anything else you want to add, my dear friend?
So we need not worry about this different questions or this the scaling and other process scaling and this statistical standardization and all, because only for if the questions are of a rote remote memory type questions, if different questions are asked, somebody maybe this area question came, so this batch got good marks. So here what they check is the concept. So overall, the concept. So whatever may be the question, whatever may be the problem, the concept is same, and if you derive the answer through the concept, so you will be given marks. So the same concept will be tested in different manners in different question papers. So you need not worry about that. This batch got easy question, this batch got different questions. So and all this and all we need not worry. So we just prepare for the concepts, and we if we are actively and interestedly prepared, we need not worry about that. So this is one thing. And another thing is, so this is more done to improve our standards rather than to make these things tougher. I think it is not, it will not be tougher than the previous APG or these AIMS exams. So students, those exams are tougher because you have to read a lot. Because here you have to read a limit.
Here I can say mentally tough, Dr. Bonish, because there once you join after completing NEET UG or a plus 2 mark base, whatever, a student entering into the medicine, only they have to worry about the final year exam. Here they have to worry about the All India next one and All India next step 2, because that is a competitive exam. Rather than a tougher thing, it is like they have to be in the constant preparation. That's how a student will feel, because many students after entering the medicine first 2 years they may not prepare. Third year and final year they will be preparing well, and they will get excellent marks. That's how we have seen, because entering into the college after a plus 2 is not easy. The students adjusting to the environment and getting adjusted and then started preparing medicine is all we have seen as a part of life. Even we have undergone such kind of thing. Here a student has to be in a constant vigil. That is the only point your students has to take that as an added point, which I can say.
Otherwise, if they are under proper guidance and alert throughout the course, they need not panic. But they should need some proper guidance, and they should have a vision that, okay, this score is going to be useful for my PG rank. So let me prepare more, or let me learn more. Rather than preparing for a PG, they are preparing for the MBBS course, but with a good alertness and guidance. That two things are important. They cannot just like that think that just if they pass this exam, final exam, I am MBBS. Though they can be an MBBS, if they just pass their score, they may not get the desired branch of choice. So, but whatever it is, instead of getting the competition at the end of internship, you are getting the competition only before. So they have to be in a competitive mode only for a lesser period of time. For the 4.5 years, the competition is over. But here, in the current scenario, they have to be in the competitive mode even for 8 years till you get the PG.
True.
So they should get a good guidance, and they should be, as you said, alert and vigil. They should prepare. They can get.
Yeah, I can say one among the guidance is from concept is to make the medical aspirant or plus 2 student, or even people who are doing currently are going to complete now. This is giving an insight for them, so that we can plan ourselves and we can work accordingly. Nowadays, students are very intelligent and they have a plan B and they do very well. I acknowledge one point, Dr. Bonish, during the discussion, you almost, I can say, more than 20 times concept, understand the concept. Given I have coined the word concept in 2009 when I started when I
think so now about it is materializing. Even it is known to the government.
Yeah. Even though it has materialized nicely for a long time, whatever I teach is conceptual content, whatever I guide is also in that way, because I am a very I feel like I have to read 5 to 6 times to understand the concept and remember things. So for such difficulty in grabbing people only, the coaching helps tremendously.
So my suggestion, being a part of a concept family, I suggest Anton to start a tele-helpline for MBBS students. We can offer free guidance for the students, or some counseling for those who feel or have a fear about these exams and other things, or even during the post-exam period. Or so we can start a exclusive tele-helpline number for concept on behalf of concept, and you can get a help. You can appoint a person to answer the calls, and you can identify what kind of guidance the person is needing, and you can refer the experts, whoever, after getting their appointment. You can guide a lot of students, and you can also sometimes. I know how the students feel before exams and after exams. They are a lot of depressed. They are very much stressed. They are going for substance use, suicidal ideas. A lot of psychological problems are happening. So we should not let our students suffer. So on behalf of concept, we have to really do some service to the students, we who are in need of help, who want some guidance, because nowadays, as the government of Tamil Nadu is giving this a chance to the government school students to enter MBBS. So this batch is going to appear for the next after 5 years. So they need a lot of, so such persons who are from the remote villages or who are not aware of the what is happening there. Some persons who may be in cities may be getting some awareness, but to the remotest corner of the country. So we should create some awareness, and we should help the students on behalf of concept. That is my humble suggestion to you. Definitely, I think you can start a tele-helpline number to guide the students.
Definitely we will take, and we have a lot of postgraduate psychiatry students also there. They also can help, and they can also give a hand, and we can that will be a wonderful service for our beloved juniors. And anything else you want to share, Dr. Bhuvanesh, before giving a concluding talk?
Okay, so my final words is, so don't worry about next. So we are here to help you. So only thing is just be alert, be happy, start preparing early, and definitely you can clear the next without much hurdle.
Yeah, thank you, Dr. Bhuvanesh. And one thing I want to add, from the concept, we have given next bar exit exam question bank for 1 rupee, 2,850 questions, updated question, latest type of questions for 1 rupee. It is available. Any students can download and make use of it, number one. And number two, we are giving an integrated kind of a system-oriented question, like neural science, endocrine science, renal science, pulmonary science, cardiac science, and blood science, musculoskeletal science. All those consultation from anatomy to surgery, anatomy, physiology, all pharmacology, pathology, medicine, and up to surgery and radiology consultation is being given. That will help tremendously. That is our vision. That is work is almost 40 to 50% being completed, and 8 subjects also being available in our concept next app. So we are working, and what is running in my mind is like to give something what we have yearned, what we have learned in a tougher way, and what we have earned from this medical society, from the coaching. We want to give back to the students by giving 1 rupee for the question bank, and dedicating ourselves by giving all this discussion. And one thing which I want to conclude before closing this session, my dear medical students, my dear doctors, my dear consultants and super specialists, there's a tough it is not warning something like that. We should have a vision. So what the thing is, before 10 years is 1,500 students used to come out from every year in Tamil Nadu, and that is when we were completing our house surgeoncy, not 10 years, 15 years back. Now almost 10,000 students are registering per year. So if you see the government students, almost like 5,880 students are there from the government of Tamil Nadu, and from a private sector, almost 2,880 students, roughly 3,000 students, and here 6,000 students, 9,000 students every year. +2 students entering into the medicine, which is not like in 15 years back, which is like 1,500, almost 1,500 students only. It is not we don't have a population explosion which happened in 80s, something like that. We are not having any population explosion. In fact, we are having more number of family members to single kid family is going on. 2+1 is only going on. So this increasing profession, number of doctors coming out every year is I don't find it is really good for our society, especially medical society, because there should be appropriate demand versus service. When the service is more than the demand, and the service goes in a wrong direction, even the people who acquire that knowledge is not a 2 years or 3 years job. Whatever Dr. Bhuvanesh has shared is like a next 1-2 years, after that the next step 2. All those things is very tedious job. So what I want to say is, when you have what I want to conclude is, when you have a passion to practice medicine, please take medicine. People who have joined medicine, develop your passion to treat patient. Okay, always getting the money is secondary. Always I will tell you, do something for your passion, and what the money comes out is like a what the service we render, what the dedication we render, that should be in our mind. And more than anything, I think the government of India and the government of Tamil Nadu over the period of time will improve the standard of living for doctors. But what I say is, like, we should not depend upon anyone. We are doctors, we are the boss for ourselves. Okay, so always have a plan B. I always stressing this, the plan B. I am a medicine by a professional. I am a person who was a mentor for a coaching. I do other I am exploring other things for earning, or to take care of myself, rather than relying on practicing medicine alone. The days are gone. Even what is there in the bureaucrat mind, I do not know. They want to dissolve the profession like engineering or a lawyer. I don't have an idea. But there should be always a appropriate demand versus supply. The demand is more, the supply should be more. Now in the corona, the demand is more, but it is not always which is going to happen. And the profession, which is a noble profession, where the student or a surgeon or a physician has to toil themselves for a longer time to treat the needy patients. I request to the honorable government of Tamil Nadu, the pay also should be appropriate. All these things, please understand, especially the parents. Don't send your kid for earning money. That is a bottom line. I want to stress. Medicine is not the place for earning. Medicine is a passionate job. Earning is a byproduct, because when the parents push their kids, you are not earning, you don't have much money, and when they are married, when their in-laws also telling like, you don't have enough money, you are just completed a master's. This is not good for the mindset of the doctor. This is the one which I really want to convey to my beloved society in India, in Tamil Nadu. Medicine is a profession. Somebody has to love and do it, and money is always a byproduct. And of course, our government will, when this kind of changes they are bringing, definitely the government will increase the pay for the service delivered by the doctors. And I hope all of you might be benefited by Dr. Bhuvneshwaran. Wonderful talk. I really thank Dr. Bhunesh for your wonderful explanation about the next 1, 2, and 3. And thank you all, my dear friends, my dear blood, I can say, my dear juniors, who are the future saviors of the society. Practice medicine for the passion, and enjoy your life, and have a plan B to earn, because we are having a wonderful knowledge the God has given, and find a way to earn and practice medicine for a passion. Thank you very much, Dr. Bhunesh, for the wonderful time.
Thank you, Anton. Thank you all.
Jai Hind. Bye.